The Association of Radiation and Clinical Oncologists of Nigeria, Arcon, has stressed the need for cancer care, risk control and prevention among millions of victims battling with the disease. President of the association, Dr. Nwamaka Leshebikon, has stated this during a pre-conference workshop for cancer doctors within and outside Nigeria in Abuja. Correspondent Lois Abasambo has the details.
President of the Association of Radiation and Clinical Oncologists of Nigeria, Arcon, Dr. Nwamaka Leshebikon, said the conference was timely looking at the shortage of personnel to attend to the growing number of patients in the country.
So the workshop today is essentially talking about newer technologies, newer techniques in using brachytherapy for cervical cancer and prostate cancer treatment. One of the benefits of this kind of workshop is because we have not just the clinical oncologists as myself, but we also have the medical physicists and the radiation therapists in attendance. And these are people that are required for holistic, effective management of cancer.
Also speaking, Secretary of Arcon, Dr. Olalade Kehinde, while noting that there are only 10 functional radiotherapy machines available to service over 2 million patients in the country, added that a public-private partnership is the most sustainable strategy to adopt in redefining cancer care in Nigeria.
Presently in Nigeria, we still have less than 20 that are functional. And as a matter of fact, even when you talk about functionality, we have probably about 10 or thereabout. And the implication of that is that most of our people, our citizens, have to travel between 50 to 100 kilometers or a little more before they can access it. And there's also the challenge of payment out of pocket. A regular comprehensive treatment of cancer might be about between 500,000 to maybe like $1.5 million. And you know, when you talk about $1.5 million for one person's comprehensive treatment, and more than 70% of our people pay out of pocket.
On her part, the Managing Director of JNCR International Limited, Mrs. Claire Omaseye, said cancer has done a lot of damage to patients, hence the need for early detection, treatment and prevention.
As you know, with cancer being on the increase, especially in low and medium income countries, it's important that we make sure we have the right infrastructure, that we have the right equipment from good companies with after-sales service, and of course that we train our personnel, our radiation oncologists, our medical physicists, and also our radiographers. And today we've been able to achieve this at this pre-conference workshop organized by JNC International and Electa, one of the foremost OEMs that manufacture radiotherapy equipment, in partnership with Arcon.
Other experts at the event called for prompt action by government and other relevant agencies to support victims to curb the risk across the globe. Lois Abasambo, ASO Television News.